Johannesburg City Power has disconnected electricity to Telkom over a debt of 2.9 million rand. The telecommunications provider is said to not have made any payments since 2021. Pre-disconnection letters have also been issued to the Helen Joseph and Rahima Moosa mother and child hospitals. City Power says that failure to pay within 2 weeks will lead to cuts. Helen Joseph Hospital's debt is put at around 23 million rand, while Rahima Moosa is said to owe about 7 million rand. The power utility is ramping up its crackdown on defaulting customers across Johannesburg. Well, City Power management is concerned, in fact, about the rising level of debt, not just by private citizens, but as you're hearing, public entities as well. Let's speak about the situation with its revenue collection head, Thami Mathiso. A very good evening to you, Thami. Good to have your time. So this ballooning debt that you're now trying to crack down on, how do some of these entities even get to owing you as much as they do, especially these hospitals?
Yes, good evening to you, Tembekile, and to the viewers. It is a concern for us. I think we are clamping down on all type of customers. I think we've seen in previous weeks, we've went to businesses, we've went to township collectively who owe us. And today, yes, we did visit Helen Joseph and Rahima Moosa. And I think for the hospitals themselves, because of the humanitarian crisis, there has been quite an extended levels of engagement with the hospitals and to try and resolve the issue of the debt. And I must say that what we did today and what we might probably do in the next 14 days would definitely be the last resort on us trying to recover the monies.
And what would that be in 14 days? Are you looking to cut off electricity supply to Rahima Moosa?
Yes, and unfortunately, I think what will then happen if we do not get the monies owed to City Power, we will definitely be left with no choice but to disconnect the power in those establishments.
And Rahima Moosa and the Helen Joseph Hospital collectively owe you about 32 million rand. Over what period, what time frame was that debt accumulated, and what were the reasons given for the non-payment?
Yeah, most definitely. I think the collectively the hospitals owe us over 23 million rands. What has happened in the past is engagements that has taken place between the Department of Health and the establishment themselves. To a certain extent, we do understand that in some instances they've got a payment models where payment gets processed from the hospitals and gets sent to head office for head office to actually pay the outstanding bills. And in most cases, there would be those administrative delays that actually takes place. But after many follow-ups that we have done, we then had to resort to what we did today. That would be to go to those establishments and issue the pre-termination notices.
And legally, though, how much of a complication does that pose when you consider the work that happens at a hospital, right? So the staff there are dealing daily with trying to keep people alive. The bills aren't being paid, sometimes because of issues in terms of revenue collection beyond the powers, if you will, of the people who run these hospitals. So legally, how do you begin to navigate that difficulty, that complication?
Yeah, most definitely. I think from our side, procedurally, just to make sure that there is sufficient preparations, and we do understand that it's, as I said, it's a last resort for us to have to disconnect a hospital that services thousands and thousands of people. But procedurally, what we then do is to serve them with a notice, so that in case in the next 14 days nothing can be done, the necessary arrangements can be done by the hospital to make sure that we don't risk switching off power where people are in operations or people are doing critical procedures there. And that's why we issue this pre-termination to notify the establishment of our intention to disconnect power should the account not be settled at that particular time. And I think this is drawn from the previous court cases that has actually happened to say we needed to give our customers an opportunity to, before we switch off the power for non-payment, we have to issue them with a pre-termination notice, which will then advise them to take necessary precautions. But as I said, it's a last resort from our side.
And one of the other things that we're hearing tonight is that, in fact, the health department is disputing these bills and will want to take you on that score. Are the numbers that you are quoting for Helen Joseph and Rahima Moosa Mother and Child Hospital 100% accurate?
Most definitely. I think we stand by our numbers, and I can also confirm that the CFO of the health department has actually been in contact with our CFO to try and reconcile the numbers, and definitely we will give them an opportunity for them to present whatever that they needed to present and meet each other. But we are definitely confident of our numbers.
What are they saying is the reason why they doubt the accuracy of these figures?
Yeah, so the issue is that they are of the view that certain months have been covered in terms of payment. For example, when Rahima Moosa, they were showing us that they have made payments. The only outstanding payments they have is from July, August, and September, of which they had system problems. It's only 3 months, and of which we've gotten an average bill in that establishment of around $1 million or so. And we have a much bigger debt, obviously, of about 7 million there. So they do acknowledge a portion which they had said they had issues with their system, and of which I think we did highlight to them that we were not informed of that system glitch that they had. And that's why we are willing to hear them out to say what other payments are not reflecting on our system.
But Thami, I wonder how much of this billing crisis, not a billing crisis, but revenue collection or debt crisis that City Power is facing is the result of a failure or too much of a leniency by your department as revenue collection, because we're hearing that there are entities that have not actually paid their bills from 2021, and 2 years on, only now are we seeing much more punitive action against them. Why have you not acted sooner?
Yeah, most definitely, and I think I can in fact, when it comes to both the hospitals, I can definitely, we have been engaged with them, and obviously from the humanitarian crisis, as an organization, we treated the hospital differently, and that's why I think going forward, it might not be proper for us to continue. It would be irresponsible for us to continue to allow the debt to increase in these measures. But I can assure you now that we are clamping down on instances currently where customers, where our technicians are being intimidated. We are clamping down on instances where our technicians are not being given access or being refused to disconnect. And that's why when we go to some of these establishments, we go there with, the backup of JMPD and other law enforcement agencies, because we have assessed the risk and having been notified of some of the challenges that are posing there. So some of the escalation of the debt is because of us being prevented to execute the task that we have been given. But at this point now, we are clamping down on.
Thank you very much for that, City Power Revenue Collection Head, Thami Mathiso. Good to have your time.